is if we determined our patient did not have antibodies for the virus in question, how would administering antibodies work? So often this is a condition, or this is a situation that happens, for instance, if a child or a person steps on a rusty nail, for instance, and it's suspected that possibly the individual might be exposed to tetanus, to the tetanus bacteria. And so that possible tetanus exposure is such that antibodies are given right away. And they're often given in the form of a gamma globulin shot. And what that does is it actually provides antibodies to tetanus immediately. So basically, you get antibodies to tetanus, when you go in to be seen about, stepping on a rusty nail, for instance. And what that does is it gets the body started in terms of eradicating the bacteria. And then once the individual is able to develop their own antibodies, then their own antibodies will take over. But this is a way that you can actually kind of prophylactically, so to speak, treat somebody if you have a strong suspicion they were exposed, because we don't really want to wait around and see whether or not indeed our patient is exposed to something as extreme as tetanus. We'd rather just give them antibodies right away. So that's the reason why in some cases, another disease where that happens is rabies, that if you're suspected of being exposed to rabies, you will be given rabies gamma globulin right away. So that concludes our discussion about antigens and antibodies. Thank you very much for visiting Educator.com.